I'm here again today with Dr. Weiner, who is a facial plastic surgeon, and he's based in Florida, in the US. We're going to talk about the LaseMD, which is a new device which has actually just been released on the market in Australia, hasn't it?
And in the US as well.
And in the US as well. Okay, so it's a world first, and it's basically for pores, for pigmentation. Tell us what it's about, because I'm quite excited by this product because it's, apart from the fact it looks good.
So this is a resurfacing laser, and it's a 1927 wavelength. And you roll it over the skin, and it goes very superficially. It treats textures, pores, pigmentation, and it gives a general resurfacing of the skin, kind of like an aggressive peel.
Okay, so for someone like me who's got quite large pores, this is going to be really effective?
Yes, that's true.
All right.
And it's a very gentle laser, and most people can tolerate this without any numbing creams whatsoever. There's very little downtime associated with this, maybe some mild redness for a day or two, but there's really no restrictions afterwards except for sun exposure, obviously.
All right. So basically you go into the clinic, you have it done, it's just like a one run over treatment.
Okay, so this has little rollers on it.
Yeah.
And you kind of roll it over the skin.
Okay.
And you do anywhere from 4 to 12, maybe up to 16 passes.
Okay.
And each pass takes about a minute or so or less. So it goes very quickly.
Right. So a treatment takes about how long all up?
10, 12 minutes.
Great. So it is a kind of lunchtime treatment, because could you put makeup straight on, or a bit of, so that you're not too red, could you put like a bit of mineral powder straight on?
Sure.
So you could get this done at lunchtime, has a bit of rejuvenation. All right, now is this a one-off treatment, or is it like, you're going to have a facial regularly? Is it something that you do regularly?
It really depends on the degree of problems that you're trying to correct.
Yeah.
If you're doing preventative maintenance, it's a one-off. But if people have a lot of pigmentation, I would do at least 3 or 4 of these.
Okay.
And then touch-ups once a year or every 6 months. But it's very easy to do. We call it a laser peel almost.
Okay. And with the person having the treatment, do they need to wear the glasses?
Yes, you need to have eye protection.
All right.
Yeah.
So it's
any laser you do.
Yeah.
But this is actually a very safe laser for the eyes. It's not going to, if it inadvertently it gets in your eye, which I've never had it happen, it can't cause blindness. It just cause some irritation.
Yeah, I think in Australia we have all these regulations, so people are really, really careful and quite rare about it. All right, and the other thing I was going to ask you is it's something that you can use long term, isn't it? So say, for example, like I've got quite large pores, and apart from, like, I'm always having, having the squeeze or whatever, but something like this I could just go once a year and keep that maintenance up, couldn't I? And it would keep them nice and tight.
Yes, that's true. Oh. And it also helps, I forgot to mention, like your superficial fine lines and wrinkles.
Yep.
And then the other benefit of this is associated with these infusions. So they have a retinol infusion, a resveratrol, some growth factors, some vitamin C. So all that, because you put little teeny holes in the skin with this, and then you infuse that solution, so it gives you an extra benefit as well. Almost like a super facial.
Yeah, sure. And would you, with the infusions, is it one at a time, or can you add them all together and like have the vitamin C infusion, or do you do like just do an infusion with vitamin C and then you do another run with something else?
Yeah, that's correct.
Yeah, okay, so just do one at a time.
Right.
So that's good, so you're getting the vitamins deep into your skin.
Right, so vitamin C is great to help with collagen.
Yep.
So for patients whose skin is kind of saggy and thin, vitamin C would be a great one.
Okay.
If you have a lot of sun exposure, a lot of oxidative stress, resveratrol is a great one because it's a great antioxidant.
Okay.
It's the stuff that's found in red wine.
Okay.
And then the growth factors are great for everyone.
Yeah.
They just stick in the skin and bring out the stem cells and so forth.
Okay, so it sounds like it could actually be the sort of thing that you have as a regular maintenance thing as well, where you're just needing a bit more
Right. I wouldn't think of this as most laser treatments. It's very mild.
Yeah.
It's not very aggressive. There's not a lot of downtime associated with the other laser resurfacing. It's a non-ablative laser.
Yeah.
There's two categories of resurfacing lasers, ablative and non-ablative.
Okay.
And a non-ablative is more gentle,
Right.
and a more ablative, you have to stay in the house for a while.
Yeah, sure. So basically it's a non-ablative laser machine that infuses the products into your skin as well at the same time.
Yes.
Okay, sounds great. I can't wait to give it a go.
Right.
I really can't.
Yeah, this is going to be. We are actually using it pre-FDA approval. It's going to be approved apparently within a couple of weeks in the U.S. So we're one of the first to give it a try in the U.S.
Fantastic. So brand new.
Yes.
Excellent. So there will be a few of these in Australia. So if you'd like to find out who actually has this device so you can go into the treatment, just drop us an email at help@plasticsurgeryhub.com.au. Or send us an email or a phone call if you like as well. So thank you so much for your time today.
Thank you.
Thank you.